Welcome to the Physician Pharmacist podcast, a show designed to shed some light on a very unusual pathway into medicine. I'm your host, Nathan Gartland. I'm a licensed pharmacist and second-year medical student. I'm also the author of PharmD to MD and the owner of the Physician Pharmacist Company. Most pharmacy students and professional graduates are aware of the possibility of going to medical school, but very few actually take the leap. We are here to unpack some of these details and open your eyes to the possibility of a career in both pharmacy and medicine. In today's show, we will cover topics related to applying to medical school, an in-depth look at osteopathic medicine, the importance of research, not only for pharmacists, but for medical students alike, introduce national medical boards, and finish up with expectations for clinical rotations. I'm very excited for our second episode of the Physician Pharmacist podcast mini-series, where we will be interviewing Dr. Bryce Brohol, a second-year medical student and good friend of mine from pharmacy school. Dr. Brohol first began his journey by attending Duquesne University, where he completed his pharmacy doctorate in 2020. Upon graduation, he elected to continue his healthcare training by receiving his medical education at Liberty University College of Osteopathic Medicine in Virginia. He is also almost done with his second year of medical school and has begun preparation for our first set of national medical boards, formerly known as USMLE STEP 1 and the COMLEX. Welcome, Dr. Brohol.
Hey, Dr. Gartland, good to be on. So as I said, my name is Bryce Brohol. I'm a pharmacist graduating from Duquesne University in 2020, originally from Hershey, Pennsylvania, now located in Lynchburg, Virginia.
All right, wonderful. Well, thank you for joining the show today. We're just going to start out with a few general questions, and then we'll kind of work through the episode and address some of the points that we covered in the beginning. So now that we've heard a little bit about you, let's start unpacking some of the details of in your origin story. What got you started with pharmacy in the first place?
So I feel like a lot of people who get into the medical field in high school, I was always good at science and math. I feel like the natural progression is their first thought is obviously something in the medical field, not necessarily pharmacy or medicine necessarily, but something in that area. Pharmacy offered a little bit of an expedited route, only 6 years at most schools. It came with a fairly prestigious title, a doctorate, and a pretty good starting salary.
That's fantastic. Yeah, I mean, that's part of the reason, how I started with pharmacy in the first place as well. So, was going to medical school then always like your plan? It seems like you were focused more on pharmacy for that, initial period of time.
So to be honest, I always had an interest in medicine. I remember being a freshman and a sophomore at Duquesne University, where I was doing some volunteering at a hospital. It was a requirement for Duquesne University undergrads. And I remember seeing the physicians, the residents on rounds doing their thing in their offices. And I was always really in awe about that. I thought it was so cool. But I didn't want to dedicate that much of my life to studying. I always thought, I don't want to be in school until I'm in my mid-30s. So I kind of pushed it to the back of my mind. Fast forward a couple of years when I'm on our introductory rotations. It was my IPI 2, actually. I was in the ICU at one of the nearby University of Pittsburgh hospitals. And when we were rounding in the ICU and the team, I kind of watched the residents, the fellows, and the attendings interact. It was kind of sort of an epiphany where it was like, wow, like that's what I want to do. Like, this is it. It wasn't something I was looking for, something I expected. It kind of really just came out of nowhere. And from there on out, that was it.
Yeah, absolutely. Well, was there anything in particular that like really solidified it, or was it just the cohesiveness and like the hands-on part of medicine that, really invigorated you to like pursue this particular career?
So it was kind of the going back and forth between the attending, and I believe he was the acute care fellow at the time. It was kind of just their open discussion they had with each other where they were guiding how the rounds were going. The pharmacist was important, the nursing staff was important, but these were the guys, they were in charge, they were making the medical decisions, and they were the one kind of using their expertise to really guide the treatment of the patient. And that's something that really appealed to me and something that I didn't realize that was important to me until I kind of saw it in action for the first time.
Yeah, absolutely. And then kind of using that, your pharmacy knowledge and background to kind of take that level of care to the next step is, super important as well. So additionally, let's kind of look into your medical school application period, because we, both of us went through this at the same time. And we did it during our pharmacy tenure. And, that had a whole bunch of, pitfalls and issues with that. But so let's talk a little bit about applying to medical school. We already addressed some of the application logistics in our first episode of the series with Dr. Timothy Dew. But I'd like to further this discussion, with your own reflection and expertise. So when did you apply? What roadblocks did you overcome? And how did you tackle the MCAT?
So I applied, I submitted my application, it was around June or July in the summer between my 5th year and my 6th year. So I would say I started working on my application just before clinical rotations or APPEs started your 6th year. I would say, honestly, the largest roadblock, I would say, wasn't even the MCAT. I'll touch on that here in a second. But I would say the biggest issue is realizing that I all of a sudden had to build a CV. I was not extremely involved in pharmacy school because I'm sure, as a lot of you watching this know or listening to this know, is that in pharmacy, unless you're interested in an extremely competitive residency program, it's kind of a little bit more completion-esque. You don't really need a really high GPA to get into a lot of different pharmacy fields, specifically retail. Being involved in organizations is kind of fulfilling and can be fun, but it's not as important. Unless you're looking for that high-level residency, it is more of a completionist thing, where, if you're applying to medical school, it is very important based on your research, your volunteering, your grades, things like that. So kind of overcoming those first 2 years where I really wasn't terribly involved, that was a challenge. Moving on to the MCAT. The MCAT was a challenge, but I would say it was more so for a challenge because we had to navigate it while we were involved in the rigorous pharmacy curriculum. I can honestly say that pharmacy was just as hard, if not more difficult, than I found medical school to be. So finding time to tackle an exam as enormous and just intimidating as the MCAT, while also trying to keep up my grades in pharmacy school, that was a very large challenge. I found myself doing 14, 15 hours of studying a day, 7 days a week for probably 5 to 6 months straight. And that became exhausting after time.
Yeah, I definitely can reminisce of those fun late night library sessions. And you said a lot of good stuff in there and that I want to unpack real quick. And just to clarify for the audience, when it comes to medical school applications, most of you might not be aware that it's actually a year-long process. So you basically have to have your whole application set up and prepared ahead of time in comparison to maybe something like a residency, like a pharmacy residency that can be done, obviously through the tenure of your school as you get research projects and so on, and, work on your grades. But the actual application period is relatively short compared to the medical school process. Yeah, I love that. And then especially with the MCAT, that's a very important medical school metric that a lot of, pharmacists and, regular medical, applicants overlook, in the sense that they think this test is something that can be shooed away from, and it really isn't. That we ended up having to take the exam twice. Do you want to tell us a little bit more about, our first and second attempts at the MCAT?
Yeah, so me and Dr. Gartland here kind of had a time on the first MCAT go around. We both, I think, largely underestimated it. I had never taken an exam like that before. I didn't realize the level of importance weighed upon not only the facts and the details of all the different body systems, but really just taking the exam. Getting used to an 8-hour exam is not something that should be overlooked, because I would argue that is far more important than the information itself. I believe I think I might have taken a single full-length practice exam prior to taking it the first time. And obviously, as we discussed, I took it twice. So the first exam score did not go too well. The second time around, I believe I took somewhere in the neighborhood of 9 or 10 full-length exams. And obviously, seeing that I'm in medical school now, it kind of went a little bit better than the first time. So definitely would recommend taking more time to practice questions and practice full-length exams.
Yeah, I'd 100% agree with that. For anyone interested in, pursuing medicine, focus on the MCAT. It's going to be your primary, barrier to entry for a lot of medical schools, considering you have the pharmacy background and life experience that a lot of other applicants might not have. So moving on, how many programs did you end up applying to? And what would you recommend students apply to, more or less of the number that you picked?
So I was in a fairly unique situation. My GPA coming out of pharmacy school was not great. You will be evaluated with your GPA side by side as someone who did philosophy as an undergraduate or psychiatry. So where they were getting a 4.0, taking general science courses for 4 years, we were taking pharmaceutics and all these clinical body system pharmaceutical courses with high level biology, chemistry. So they don't really give you too much slack. So my GPA was on the lower end. At the same time, I also had an academic integrity from my freshman year. So that's something that weighed negatively on my application a lot. So that being said, getting back to the question, I applied to a lot of programs. I believe it was something around 15 osteopathic programs and 40 allopathic programs. That is far more than the average student. I believe the average is somewhere between 18 and 20 for the normal applicant. But like I said, that's something that you would need to tweak to your application, your strengths, weaknesses. As far as are you willing to move across the country? Do you want to stay where you are? It's a very personalized decision, I would say.
I think it's funny too. There was a point in time where we would add another program pretty much every other week, and then you would text me, "Oh, I just added this program," and I would be, very pressured to also add that program. So we're probably building off of each other a little bit there. So definitely, yeah, like you're definitely right. The amount of most applicants apply around 18 to it's raising, so around 25-ish as well. But there's no perfect number. I think it depends a lot on like the statistics of the individual. So additionally, applying to medical school has a lot of moving parts, but one feature that is commonly overlooked are letters of recommendation. How many letters of recommendation should applicants get? And do students need a DO letter, from a physician, like a letter of recommendation from an osteopathic physician for like admittance to an osteopathic program? Because this is something that I came across and it held me up in some areas.
So once again, it's not really a clear-cut answer. You're going to have to do a lot of research about individual programs because every medical school has their own requirements. Some are very easy and vague. Well, they'll say, "Hey, just give us 3 letters from faculty at your school." Nothing more specific. Some will say, "Hey, you need 5 letters. One is science, one is non-science. One needs to be a principal investigator for a research project. One needs to be an administrator, and one needs to be a physician." So it really depends on the school. Overall, I believe I had 6 or 7 total because you can pick and choose which letters you send to which programs. So overall, I'd recommend you get 2 science faculty. I would say 1 non-science faculty. I would get a letter from a research faculty member, a letter from an administrator in your school if you're close with any of them. I would also recommend getting 2 physician letters if you are applying to osteopathic programs. And I'll touch on the osteopathic one in a moment here, but definitely if you can, 1 allopathic and 1 osteopathic would be best. As far as needing an osteopathic letter for their program specifically, that's also going to depend on which schools you apply to. A large number of schools do require a letter from an osteopathic physician, but I would say it's not an overwhelming majority. I would say probably about 60%. The other 40%, however, they strongly recommend it. So is it a requirement for those programs? Absolutely not. However, if you're looking to get into medical school, you don't really want to lower your chances any more than you have to. So if possible, it's definitely better. You're better off to try to get one.
Yeah, that 100%. I think the general recommendation is to get approximately 5. And then obviously the more letters you get, the better, because, you can pick and choose, like you mentioned, of which programs they go to, or if you have a very strong research letter, that might be something that you utilize for a heavier research program, heavier, emphasis on research on their application. So you also mentioned a little bit too with API rotations, I guess with IPPs, that was influential in, kind of in figuring or helping you direct yourself towards, a pathway in medicine. Was there anything that you experienced on API rotation specifically that furthered your interest in medical school?
So I would say, yeah, as I went through my rotations, I would say my overall interest in medicine definitely increased. I felt like it verified what I had learned in my second introductory rotation. I felt like I had made the correct decision, not only because I didn't really enjoy the pharmacy aspect as much. There's no doubt that pharmacists have an immense importance in the medical field and patient care. I think a lot of physicians would be lost without their pharmacist on call in a lot of hospitals. That being said, it wasn't specifically for me, as because I am where I am obviously now. That being said, as far as specific specialties, I would say that there's nothing in my appies that steered me towards a specialty, but it definitely steered me away from a few. Just for example, I loved our oncology class when I took it in pharmacy school. I thought that was going to be a really strong interest for me going into medicine. And then I did a clinical oncology rotation at the Johns Hopkins Hospital in Baltimore and hated it. It was depressing. It was just absolutely not something I could see myself doing. And I think I realized that I liked the course professor, the professor who taught us, more than I liked the information. So that was a little bit of a difference there. So it's something that I've definitely realized is not in my future. So there was that benefit of my rotations.
Yeah, and that's exactly what rotations are for, is to kind of check off a few things. You might not find the perfect match, when you advance through those particular rotations, but you will definitely cross some things off the list. It's funny because I remember, my Hopkins rotation, and I absolutely loved my oncology, rotation, but you're the opposite of that. But I also hated cardiology, so it just kind of goes both ways, and that's something I know you're interested in. All right, so let's take a few minutes and talk about osteopathic medical schools and unpack some of the ambiguities, of osteopathic medical education. I'm sure some of the listeners are curious to explore the differences between this field and traditional, like allopathic medicine, such as MD credentials. To some, the credentials DO are a mystery, despite their abundance and equal ability to practice under law. Could you give us a short overview about the profession?
So honestly, the simplest way to put it is the osteopathic physician and the allopathic physician, there's no difference clinically. The real difference comes in is that osteopathic physicians are required to complete, and it's going to change depending on the school, somewhere between 300 to 400 hours of osteopathic manipulative medicine practice when you're in school. So if that has its benefits, however, it does make things a little bit more time consuming. Less time to study for boards, less time to study for courses. So it can be a bit of a negative depending on who you talk to. But that really, I would say, is the only true difference. In practice, I don't know if any of the listeners have a lot of experience in the hospitals. However, a lot of the time, the physician's name tags will just say physician. You won't even know if they're an MD or a DO. There's actually been a few times I remember from appies where the physician's name tag said MD, and I looked them up to see where they went to school, and they went to an osteopathic medical school. So there's really just, after medical school, after rotation, the ambiguity between them really is almost non-existent at most institutions.
And you mentioned this additional training. I believe it's called like osteopathic manipulative medicine, or something along those lines, OMM. Can you tell us a little bit more about what that is exactly? I know that it's a hands-on approach to medical care, but could you unpack that a little bit more for us?
Yeah, so osteopathic manipulative medicine is basically the hands-on portion of what you will learn as an osteopathic physician. I would describe it best as a hybrid between physical therapy and chiropractic. It's a little bit more of the milder aspects of chiropractic. It's a lot of range of motion. It's a lot of looking at tissue texture changes, looking at displacement of muscles, bones, things of that nature. And really what it is you're basically looking for a simple way to treat a patient's condition without prescribing medications, without ordering expensive tests, something you can do right there in the office that if it solves their problem, phenomenal. And if it doesn't, you still have all the tools that an allopathic does to continue on with their treatment. So that's really the best way I can describe it. It's kind of just a first step therapy that in the right situation, it can maybe be advantageous. And other times, like I said, you can kind of just move on and treat them as any physician would. And it's not used in every situation. Obviously, if the patient comes in with difficulty breathing and heart palpitations, you're not going to be looking to treat them with OMM.
Absolutely. And, as a fellow pharmacist, I can understand, avoiding medications as much as possible because we know all the side effects that are associated with them. And polypharmacy is a major problem. So looking for alternatives that might be more effective before we non-pharmacologic, alternatives is definitely an important facet of medical care. So I've also heard some arguments that osteopathic medical students have a harder time matching into competitive specialties. How true is this statement? And Is there truly a disadvantage, or is this more of an antiquated viewpoint?
So it's kind of a little bit of a give and take. Overall, the answer would be yes. It is harder to match into a competitive specialty as an osteopathic student. Um, I think the word I think the words more difficult, the phrase more difficult has morphed into impossible in some circles. I have spent my fair share of time on studentdoctor.net and Reddit, and you will see a lot of misinformation on there. And like I said, in general, yes, it is more competitive, but that is far from impossible. Um, just recently in our last class, we had this past match a couple weeks ago, we had two students matching into dermatology, two into orthopedic surgery, and somebody matching into radiation oncology. So there really isn't any specialties that are off limits. It's just going to require a little bit of harder work. It's going to require a little bit more perseverance. And to be honest, if you're motivated and it's something you want to do, it really shouldn't be a problem. I personally am interested in orthopedic surgery, and really I'm doing everything I can to make that possible. Extracurriculars, research, grades, and I truly believe that it's not going to be an issue for me. On the flip side of it being more competitive, it also in some specific residency programs, it's almost easier because you do have the traditionally osteopathic only residencies. Prior to the merger with the NRMP, or I forget the actual name of the organization, but the merger with MD and DO residencies, technically MDs can apply to those residencies, but historically and even after the merger, they do traditionally take DOs only. So you do have a fair number of spots that are almost reserved, for lack of a better word. So there is opportunity.
Yeah, and I think a lot of that information, that misinformation that you were discussing, is an antiquated viewpoint in the sense that it's been many, many years since that data has been, pushed out there. And I think programs are becoming a lot more accepting of having, DOs on staff, and they're becoming equal, basically, professions. Not to say that they weren't equal before, but when it comes to matching into some of the more prestigious, traditional medicine residency positions. So I think within the next 10 years, there will be no distinction between them, which is, a wonderful thing. So let's take a minute and transition over to research. So similar to pharmacy school, medical students are expected to get involved in academic research to help bolster their future residency applications. I have been a major proponent for working as a pharmacist while in medical school to stay up on my license and generate some additional income. Because of this, I'll admit that I've been much less involved in research during my tenure. While I still feel there's ample time to get involved, I wish I had gotten involved a little bit sooner to have some more projects under my belt. I know you personally have chosen to work a little less to forward your research aspirations. So my question for you is, how has your pharmacy background helped you conduct research, and why is research so important during medical school?
So I would like to preface and say that I have not worked during my time in medical school. I am licensed in the state of Virginia. I could go work in a retail pharmacy if I wish to. And I would also like to say that I could with the time constraints. There'd be no reason that I couldn't pick up 1 or 2 shifts a week and make that entirely possible while still being successful in medical school. I have chosen not to, just because with my interest in orthopedic surgery, I felt like I kind of needed to dedicate all of my time to schoolwork, research, extracurriculars, grades, things of that nature. With research specifically, I feel that my pharmacy background, in completing the research, I would say it hasn't really had much of a benefit either way, or a negative. I think where it's helped is kind of seeking out research projects. Coming from a pharmacy school and coming from a similar doctorate program, you realize, how to find projects, what's the best way to go about doing things, how to network and work your way into different avenues of research. And that's something that I didn't really have to learn. It was something I already came in with that knowledge base. And I'm sure there are students who didn't go to pharmacy school who had that knowledge as well. However, that's just how I personally felt it helped me the most. It wasn't kind of I wasn't walking in blindly. I felt like I had a good background to build on how to find projects, how to network, and how to really make the most of my situations. As far as research being important in medical school, I would say it's that my interest is going to change based on what specialty you're interested in. I would recommend everyone does some sort of research, because in the end, you don't want to get to your third years, realize that you love surgery or dermatology, and then realize, hey, I didn't do anything yet, so I better get it in gear. So I'd recommend finding something. However, that's not saying that everyone needs to go out, have 7 posters, 4 publications, and 5 more being written as manuscripts currently.
Yeah.
So it's going to be very person dependent.
Absolutely. And yeah, like you said, it's very dependent on the particular interest that you have and what kind of specialty you want to pursue later on. I know for orthopedics, I believe that the most recent data suggested that applicants who matched needed about 5 research projects. It doesn't really define if it's a publication or, presentations or just being involved in a project. So, that's a pretty big number to kind of meet and match. And obviously you want to be above the average when it comes to competitive specialties like vascular surgery or radiation oncology, like you mentioned, or even dermatology. So definitely being on top of that and using your pharmacy background is very helpful when it comes to finding projects. I think a lot of it too comes from, like you said, the professionalism component, how to approach a lot of the research coordinators, as well as just having that PharmD behind your name. It's essentially like some credentialing, and you're basically a shoo-in for any kind of medication-based project. They want you on this project. Oh, you're a medical student and you're a pharmacist. Wow, this is perfect. It's meant to be. So I think that's also a very helpful feature. So transitioning on, so essentially it's difficult to work on projects, obviously, during the semester. Is there anything, you would recommend to pharmacy students or medical students? How do they balance doing research while doing good in school?
Yeah, so I would honestly, my first recommendation is don't do research your first semester. I know some people do, and there's a lot of people who are good students who can manage both. However, everyone in undergrad thinks that they're going to get into medical school and knock its socks off. They think they're going to be the top of their class. And in reality, I think as a pharmacy student, you're a little bit more prepared in this avenue because you've already dealt with a rigorous course load. However, a lot of people don't realize how difficult it is. You can hear other people's perspectives, but in the end, you have to really experience it to know that, hey, you're going to be studying 80 hours a week. Like, at least some people will. Some people can get away without doing that. However, so I would get your footing first academically. Find out what works for you, how to study the best with the least amount of time, being the most productive with the time that you're putting in. Once you go from there, you can find time to work in your research projects. A lot of projects are not going to take up 20, 30 hours a week. I know a lot of my projects require me to do maybe 2-3 hours a week. And then obviously that can give or take depending on what's going on. But really, like I said, just find out what works best for you academically and studying, and then you can kind of figure out how much time can I divulge to research? When can I do it? Maybe if you have an exam coming up, maybe make it a little bit less effort. But like I said, it really, the first thing you got to do is find out, how to go about your academics the best way you can.
Yeah, and always having research projects not only helps, your application to medical school, but it also will help your application for pharmacy residencies. If you're not particularly interested in medicine, or you might be interested in medicine 2-3 years, outside of school. So it's important, when you have those resources to take advantage of them, reach out to research coordinators, reach out to your faculty and seek out those opportunities, because they're there. They might just be tucked away. Awesome. So I think we're ready to transition to our next big topic, which is discussing Step 1. And Step 1, to clarify, is the USMLE Step 1 exam, which is basically the first of 3 national licensure examinations required to practice medicine. This is essentially like a NAPLEX, but during the middle of medical school. So traditionally speaking, your score would serve as a major qualifier to make you competitive for a specialty of interest. Just this year, there was a massive decision to make the exam pass-fail. So what is on this exam, and how much do medical students typically need to study for it? How would you compare it to the NAPLEX, to put it in perspective for our listeners?
So in comparing it to an exam, I would say it's far closer to, well, for people who haven't taken the MCAT, I would compare it way closer to the MCAT than I would to NAPLEX. But to kind of describe what is on the exam, I would say it's basically just a culmination of everything you've learned in your first 2 years of didactic curriculum. It's very nitpicky, it's very detailed, and it's very disease oriented, I'll say, for lack of a better term. Basically, it's questions that will give you a list of symptoms, maybe some imaging, maybe some labs, and you'll basically have to come to the conclusion of, what is this patient dealing with? They'll throw in biochem, they'll throw in histology, things that aren't as clinical in nature, but are extremely important for physicians to understand and have a background for when they're making clinical decisions. As far as how much you need to study, this is we're kind of shifting in a new direction here with what we just discussed as being pass fail, because prior to this, a lot of people studied for 5-6 months, kind of full time, because you wanted to get the best score possible. Now that this is shifting to pass fail, getting that top tier score isn't nearly as important, and it, quite frankly, isn't worth sacrificing your grades at your school. Me personally, I try to allocate around 15 hours a week to studying. That's going to basically depend on exams as well. So I just had a large exam the other day. The week prior, I didn't study at all, just because it was too time consuming to watching lecture and getting everything organized. However, this week I'm currently in, is a little bit more laid back. So I will probably allocate, I would probably say maybe 25 to 30 hours to kind of catch up and make up for that previously.
Yeah, I think it's been a monumental decision to switch it to pass fail. Just, from our perspective, it's much easier because we don't have to put in as much effort at the time. And I agree with the decision, just because, like you mentioned, the material itself, it is more clinically minded, but a lot of it is very superficial clinical medicine. There's not as strong of an emphasis on medications. It's very nitpicky, like you mentioned, as well as there's a lot of histology. For our listeners, histology is essentially cells. It's not something you get exposed to quite a bit in pharmacy school. So when I had my first histology class, I was pretty confused of what was happening. We were looking at like microscope slides. So it's pretty useful for a pathologist perspective, because that's how we make a lot of diagnoses based off of like cellular pathology. But that's also something that we're tested on, which I don't think is completely relevant, especially when 90% of the people graduating, I'd say 99% of medical students who are graduating are not going to be pathologists. So I don't know why we have to look at, cells in a petri dish. But that's my 2 cents. So as an osteopathic medical student, do you take different boards than the USMLE Step 1?
So yes and no. So to be licensed in the United States as an osteopathic physician, you are required to take COMLEX. What the acronym stands for is slipping my mind at this exact moment, but basically it's the osteopathic equivalent of USMLE. Instead of step 1, you take level 1. Now, for the yes and no component, like I said, you are required to take all 3 levels of COMLEX, level 1, 2, and 3. However, if you are interested in a specialty that is predominantly MD driven, which, if we're being honest, are most of the more competitive ones, it's not mandatory, but it's almost an informal rule that you should take USMLE as well. I will personally be taking both exams, and I recommend that any osteopathic medical students or pharmacy students applying to osteopathic medical school, I recommend you take USMLE in the future as well. I hope that will switch someday and that you want to take both sets of boards, but as of now, that's kind of the hand you're dealt if you want to remain competitive for a lot of these tough specialties.
Yeah, absolutely. And, I think it's interesting too, that this decision to make it pass fail, it forces students to focus not so much on, one single exam that defines their entire career, and allows them to bolster their application, like we've mentioned already, through research, through a community involvement, through shadowing experiences, and obviously, academic grades. So I think it's a good direction that we're headed in, although we're the guinea pigs for this experiment. So I might have a very different opinion in a couple years. All right, so gearing up for clinical rotations, we're going to switch over to our last topic of the day, which would be our medical school clinical rotations. So unlike pharmacy, medical students start their clinical rotations during their 3rd and 4th years. Some programs are even starting rotations after just 18 months of education, so about 1.5 years. Like most things, students tend to learn the best through hands-on experiences. Similar to API rotations in pharmacy, medical students are expected to complete several mandatory experiences. Would you be able to briefly talk about the different rotations medical students take and how that would compare to API rotations? Because for API rotations, for example, we would do an acute care rotation versus, how does that translate to medical school rotations?
So to touch base a little bit on the structure of rotations, I would say the overall structure is similar to pharmacy school, where you have a set number of mandatory rotations that every student takes. These are generally, for medical students, these are generally done during your third year, and they'll include things such as internal medicine, OBGYN, pediatrics, surgery, family medicine. And then depending on your school, you may get some elective rotations during your third year. I personally don't. My entire third year schedule is picked for me. And then your fourth year, you will get your chance to do your elective rotations. As opposed to pharmacy, where only some people do residency, obviously medical students, everyone is required to do a residency to practice medicine. So some of these elective rotations will be termed auditions or sub-internships, sub-I. These are going to be rotations that you do at hospitals that have residency programs you're interested in. So it's basically just a 2 to 4 week job interview. These are things you have to apply to, and a lot of them will be the programs that you end up doing your residency at. So that's extremely important to take them as seriously as you can.
100%. And I actually appreciate that we start rotations a little bit earlier in the education process compared to pharmacy, which is in the final year. I enjoy that we started in our third year because it gives me more time to experience a lot of different fields and really hone in on what kind of medicine, field of medicine I'm interested in. So for instance, I'm starting surgery first this summer, and I've never even been in an operating room before. So I think that's a great opportunity to really, I'm just going to get tossed to the wolves, but that's how you learn the best. So it's going to be a fun experience. And I think it's a lot of different things that I might not have ever seen before, versus I guess like API rotations. I had seen a lot of like the community-based pharmacy, but with medicine, there's a lot of different avenues that you can take, like anesthesiology, or explore some other more niche topics, which I think is pretty cool. So I guess for yourself, what are you looking forward to most for upcoming rotations? I know my priority right now is, like yourself, is studying for step 1 and getting that out of the way. But once we start rotations, what are you looking forward to the most?
Oh boy. So if I'm being honest, the first thing I'm looking forward to is not having class anymore. The second thing I'm looking forward to really is getting out there and back into the hospital. If you're listening to this now, you might be doing IPPEs, or you might be in the middle of your API rotations, and don't take it for granted being out there in the clinics, actually being able to practice medicine. Going from that environment back into a classroom is not fun. And the burnout will hit you way quicker than it will most traditional students, because you're on year 8 at this point of higher education, where most of them are on year 4 or 5. So really just looking forward to getting back out there, seeing patients, just being in the environment of a clinic or hospital, I would say.
I would agree with that 100% as well. Just getting out of the library, like you said, we're on year 8, we're hardened veterans at this point, and I leave to the pharmacy, and then I come back the next morning, and I have like 3 hours of lecture, like in-person mandatory sessions. So that can definitely hurt the morale just a little bit, because I'm out here practicing, and then I'm out here. We had rotations previously, and we're basically operating, as a pharmacist in these particular settings, obviously with supervision, but it's a very different field to be in when you're actually on the wards. So it's exciting. So I am looking forward to that aspect as well. So do you think your skills and training from pharmacy will help you excel on rotations?
Oh, absolutely. However, not in the ways, in my opinion, as much as you think. Having that background knowledge of that medication is inherently important, and it'll be something that will help you succeed. However, more importantly than that, I would say that the comfortability of being in a hospital, just knowing how to act and how to attend rounds and kind of stay out of the way, but also stay involved. That's something that takes a while. And I'm sure Dr. Garland can attest. It's not something that you pick up on and really get good at until the end of your API year, where you kind of really start to get into a groove and figure out what you're doing. Aside for just how to, behave on a rotation, I would say clinical decision-making, nothing specific, but just the thought process of clinical decision-making is something that also takes a very long time to hone your skills on. And not that we are experts by any means as pharmacists coming right out of school. However, you still have a leg up on all your other peers. Being able to take in multiple different pieces of clinical information and arrive at one final decision is not something that you can just learn overnight. So having that experience in making clinical decisions is really kind of an invaluable piece of information that I think not a lot of people applying to med school from pharmacy school really take into consideration.
Yeah, I love that, because what they teach you in pharmacy school is not necessarily the diagnostic component of medicine, but they teach you first, second, third, fourth line, treatment regimens and treatment algorithms. That is something I feel like, at least in my medical education, that's been overlooked to some extent because we focus so heavily on diagnostics. So combining those two perspectives on the medical wards, I think is going to be just super, super helpful for us. Now, what do you do when this first line product doesn't work or the patient can't take it due to some contraindication? So a lot of medical students might sit there and think, I have no idea. I've never heard of these second line drugs, versus the pharmacist is like, oh, we have 5 different, products we could recommend, and here's the list of them in order of price. So I think that's going to be something super, super important. I love that point. All right, so we're coming to the final few minutes of our show today, and I want to ask a few closing questions. So do you think, this is kind of, adding on to what we just mentioned before, but do you think having a pharmacy degree will help with your ability to practice medicine or communicate with patients in the future?
So I'll kind of break that down into the practicing medicine and then the communication as well. So practicing medicine, I would say definitely. You'll realize soon enough when you're in medical school that the pharmacology we're taught is extremely baseline. They're teaching you about ACE inhibitors, and they only tell you about lisinopril and don't tell you about the 14 other ACE inhibitors that are out there and their unique pharmacokinetics and all the other things that are just important to know. At least from my experience in APPEs, you'll meet physicians who don't even really have a firm understanding of a lot of that stuff. So having that breadth and that depth in your pharmacy knowledge will become extremely important as you're going on your rotations and then into residency and then even practicing as an attending. As far as communicating with patients, I would say that definitely you have a benefit in coming from a pharmacy program. I know personally, I think that if you have any experience in retail pharmacy, I think that will benefit you even more so because, if you've been in retail, some of the patients can be difficult, is a kind way of putting it. So knowing how to manage that and how to handle people like that, that is, that's something that's going to be immensely important, because you're not always going to have your patients who love to see you and are happy to be there and just happy-go-lucky. You're going to know how to deal with the bad patients, for lack of a better word, as well.
Yeah, just having that temperament is super important, as well as that confidence to approach a patient, do an interview or a history. And then I love when you have to ask about, their chronic medications that they're taking. Well, that's super, super easy, from having a pharmacy background versus all my, peers are writing down and scribbling down everything. They're like, a atorvastatin, what? So it's just a very helpful and useful thing, I think. So I think having the pharmacy background has been influential. So for individuals considering medical school after pharmacy school, do you have any other recommendations you'd like to share with them based on your experiences so far?
So honestly, my biggest thing is if you're on the fence, if you're kind of deciding whether or not you want to go to medical school, if medical school is right for you, I would make sure that it's something you absolutely want to do. And I'm sure Dr. Gartland can attest to this, and really anyone who's applying to medical school. If you want to go to medical school, you want to be a physician, you know it. It's not something that maybe we'll see how things go. Like I described in my sort of epiphany-esque situation, I knew it immediately. Once I was in that ICU and I saw those physicians interacting with the residents and the patients, like that was it. Like I was done. Like my pharmacy career was effectively over for the long term. So just make sure that it's something that you really want. This is a long and quite frankly a miserable road, but the end goal is definitely worth it if it's what you truly want.
Dr. Brohol is not going to sugarcoat it, but no, I'd agree. You have to 100% be passionate about this career path. You have to forego, a pretty high 6-figure income. You have to forego, the relaxation that you could be having. All of your friends are finishing up residency or finishing up. They get off, they clock out at work and they're done for the day. And we're sitting here still, in the library after our, 20 hours of studying nonstop. So it is a calling, I think, but having the background really helps quite a bit.
Yeah, and just to add in, I do want to preface and say that, you know what, this I wouldn't rather be anywhere else. Like, I'm here because I want to be a physician more than pretty much anything else in the world. So honestly, like I said, it's just something, a desire that you need to have, and a lot of people do. It's definitely a calling, for lack of a better word.
And building off that final point, I don't think I asked you yet, but what kind of specialty are you interested in, and why?
So I would say I have kind of a tiers of my list. I would say number one is definitely orthopedic surgery, like I mentioned before. Um, I have an interest in surgery like you. I've never actually been in an OR before, so I'm looking forward to my first surgery rotation, and I really just hope that I don't dislike it. I am big into sports. I think it would be awesome to kind of have that hybrid between sports medicine and the surgical specialty. Outside of orthopedic surgery, I always loved cardiology. I know you kind of touched on this before, but it really was one of my favorite topics. I did an API rotation at the Cleveland Clinic main campus, which is one of the top cardiac hospitals in the world, and I absolutely loved it. So kind of in between IM and ortho right now.
Yeah, exactly. For those of you who don't know, if anyone's interested in like cardiology, there is a basically transition period where you have to do internal medicine first before you can apply to that particular fellowship, versus orthopedic surgery is direct. You just apply into that particular program. Well, great. So, alrighty, so we've come to the end of our interview, and I'd like to thank all of our listeners for their attention and interest in medicine. If you have any additional questions about medical school journey, check out my personal website, www.physicianpharmacist.com. Before we let you go, Bryce, how can our listeners get in touch with you?
Yeah, so you can send me an email. That's going to be B as in boy, and then my last name, so GROHOL at liberty.edu. Feel free to send me an email anytime. Also on LinkedIn, I think my profile is on the Physician Pharmacist website as well.
All right. Well, thank you so much for being on the podcast, Dr. Brohol. I look forward to seeing where medicine and pharmacy take you. Have a great week and best of luck with your STEP studies.
Yeah, thank you. You too.